Hello, I'm Jonothan Earnshaw, Editor-in-Chief of BJS British Journal of Surgery. Let me tell you a little bit about the February edition of BJS. I suggest we start vascular. This month has the definitive meta-analysis considering the randomized trials of open or endovascular aortic aneurysm repair, EVAR. Individual patient data are included from 4 international trials. It's now pretty well established that there's an early survival advantage after EVAR, but after about 3 years this is lost, due in part to an excess of late aneurysm ruptures after EVAR. The authors are able to drill down into the data to find the higher risk groups that were treated with EVAR. One problem is that of necessity the data are rather old. Devices were inserted from 1999 to 2008 and have improved significantly since then. In his leading article in this month's edition, Rob Hinchliffe, BJS editor, describes the new EVAR method of aneurysm sealing, where the aneurysm sac is filled with permanent material after stent insertion. Rob urges caution with overenthusiasm for this new technology and recommends compulsory registration of the new devices. We don't want to risk a failed experiment in endovascular aneurysm repair, but we do need safer, more durable devices. 2 other systematic reviews this month have useful advice for surgeons. Many colorectal surgeons remain sceptical about the use of prophylactic mesh to prevent peristomal hernia after colostomy formation. The review by Cross and colleagues from New Zealand provides reassurance. Routine mesh insertion halves the number of hernias without increasing the risks. Also from New Zealand, Amer and colleagues assess the value of carbohydrate loading before elective surgery. It seems this can produce a small improvement in recovery that is associated with a similar small reduction in hospital stay. The randomized trials in February BJS are also useful. Zerbib and colleagues from France explore the potential for sacral nerve stimulation for patients with constipation. And Keeler and colleagues from Nottingham, UK, used oral or intravenous iron preoperatively for anemic patients awaiting colorectal cancer surgery. You can find out whether the interventions were effective in this month's journal. There are 2 papers on breast cancer. The first, from Korea, warns that the use of prosthetic breast reconstruction early after mastectomy may increase the risk of arm lymphedema in comparison to autologous reconstruction. The second, from the Swedish multicenter cohort study, provides reassurance that women with negative sentinel lymph node biopsy have a low risk, around 2%, of axillary recurrence after the next 10 years. There are also 2 papers on cancer of the biliary tract. The first is a Japanese study on extended surgery for advanced gallbladder cancer. The author studies almost 100 procedures to try and establish whether extending the surgery to include hepatectomy was beneficial. Their analysis found that liver metastases and hepatic artery invasion were poor prognostic factors for survival. Yamashita and colleagues from the MD Anderson Cancer Center in Texas had an even larger cohort of over 300 patients with biliary tract cancer. They showed that blood levels of CA19-9 were useful in assessing prognosis. In particular, patients whose CA19-9 didn't fall after resection had a very poor prognosis. Finally, there are 2 papers to tell you about concerning the quality of articles submitted to surgical journals. All authors will now be familiar with the formal methods of reporting randomized trials and systematic reviews in quality journals, Consort and Prisma, respectively. Although designed to improve reporting, they actually ensure that the studies have been designed and conducted to sufficient standard. You and colleagues compared RCTs published in 2003 and 2013. They concluded that although reporting standards had improved, the quality of many surgical randomized trials remains poor. They suggest that existing consort checklists may not capture important details in surgical trials, and they wonder if a surgery-specific consort is needed. Surgeons from Birmingham, UK, did a similar analysis on systematic reviews from surgical journals. Their analysis was that Prisma had minimal impact on the reporting of surgical systematic reviews. This is, of course, disappointing, particularly at a time when BJS is trying to improve the quality of randomized trials and systematic reviews in the journal. We reject an increasing number of these manuscripts, and authors should need no reminding of the importance of compliance with the reporting standards when submitting to BJS. Before I go, just a quick reminder to visit the new BJS website to try all the new features and to personalize your BJS to fit your needs. Also, you'll find the 2017 special issue on surgical infection, which is entirely free to download and enjoy. Thank you very much for listening.